Hey friends, welcome back to my aesthetics study guide series. Today we're getting into chapter 4, Diseases and Disorders of the Skin. I know this chapter can feel overwhelming because there are so many conditions to learn, but don't worry, we're going to break it down step by step. By the end, you'll feel more confident knowing what's safe to treat in the spa and what needs a dermatologist's care. Why knowledge of diseases and disorders matters. Estheticians must recognize skin conditions, protect client health, and avoid spreading infections. This knowledge builds client trust and ensures safe, effective treatments. Collaboration with dermatologists. Estheticians and dermatologists can work together. Estheticians focus on maintaining healthy skin, relaxation, and cosmetic improvements, while dermatologists diagnose and medically treat diseases. Together, they provide comprehensive care. Skin lesions. Lesions are structural changes in the skin. Primary lesions are early stages of lesion development. Some examples are macules, papules, nodules, tumors, vesicles, pustules, wheals. Secondary lesions are later stages or result of manipulation. Some examples are scales, crusts, ulcers, fissures, scars. Tertiary lesions are also called vascular lesions, involving blood vessels. Some examples are rosacea related to telangiectasia, port wine stains. Recognize skin changes that could indicate a type of skin cancer. Skin cancer risk increases with UV exposure and it is found in 3 forms that vary in severity. Refer to your textbook or the skin cancer and sun exposure image. Actinic keratosis, precancerous lesion caused by sun damage. Types of skin cancer. Basal cell carcinoma, most common, least severe. Squamous cell carcinoma, more serious, can spread. Malignant melanoma, most dangerous, spreads quickly. The ABCDE of melanoma are asymmetry, border, color, diameter, and evolving. The ABCDEs of melanoma were super important in esthetician school for this chapter. Oncology aesthetics. Special training allows estheticians to care for clients with cancer in safe, supportive ways. Acne and related conditions. Causes of clogged follicles are excess sebum, dead skin, bacteria. Types of clogged follicles. Comedones, open equals blackheads, closed equals whiteheads. Sebaceous filaments, normal oil flow, often on nose. Milia, tiny, hard white keratin-filled cysts. Retention hyperkeratosis, excess buildup of dead skin. Sebaceous hyperplasia, overgrown sebaceous glands. Seborrhea, excess oil production. Grades of acne. I equals minor, IV equals severe cystic. Triggers. Hormones, genetics, environment, lifestyle, skincare products, diet. Treatment. Topical or oral medications, retinoids, antibiotics, birth control, isotretinoin. When I was in school, I had to memorize acne grades. Flashcards really helped me with that. Polycystic ovarian syndrome, PCOS, symptoms can include irregular periods, excess hair growth, acne, and oily skin. Estheticians can support with skincare but should encourage clients to see a doctor. Vascular disorders. Rosacea, chronic redness and inflammation. Telangiectasia, dilated capillaries. Varicose veins, enlarged, twisted veins. Pigment disorders. Hyperpigmentation. Lentigo, freckles or age spots, aphilids, freckles, nevus, birthmarks, poikiloderma of Savate, sun-induced, neck redness, post-inflammatory hyperpigmentation. Tanning, hypopigmentation, leukoderma, light patches, albinism, lack of pigment, vitiligo, autoimmune loss of pigment in patches, tinea versicolor, fungal discoloration. Dermatitis conditions, contact dermatitis, irritant or allergic. Atopic dermatitis, eczema, perioral dermatitis, redness around the mouth. Seborrheic dermatitis, scalp dandruff, oily patches. Stasis dermatitis, poor circulation related. Hypertrophies, excess growths. Examples are keratoses, skin tags, moles. Contagious diseases. 9 major ones to know include impetigo, conjunctivitis, tinea, fungal infections, scabies, herpes simplex, and others. Estheticians cannot treat contagious diseases. Always refer clients to a doctor. Mental health-related skin conditions. Some mental health disorders show up as skin issues. Examples of this are trichotillomania, hair pulling, and body dysmorphic disorder. Sudoriferous gland disorders. 5 examples include anhidrosis, lack of sweat, bronchidrosis, foul-smelling sweat. Hyperhidrosis, excess sweating. Miliaria rubra, prickly heat. Sudoriferous gland infections. Glossary review. Key terms to review in this chapter are lesion, actinic keratosis, melanoma, comedo, milia, seborrhea, rosacea, hyperpigmentation, vitiligo, dermatitis, hypertrophy, bronchidrosis. That's it for chapter 4. I know this was a lot of information, but just remember, you don't have to memorize it all at once. Flashcards and repetition will really help with this chapter. Thanks for studying with me today, and if you found this helpful, make sure to subscribe so you don't miss the next chapter. We're in this together.